We ready? Okay. Good evening, everyone. I'm Colonel Jeremy Bell, the Garrison Commander for Fort Campbell. Today, I welcome you to the COVID-19 Facebook Town Hall. It's a pleasure to have everyone here. Of course, thanks for tuning in and taking some time out of your schedule today to join us. I think we've got a good series of topics to talk about, and I think we've got a good panel to discuss. As always, when we do these Facebook forums, this is all about informing our community, providing perspective, and trying to answer as many of your questions and solving as many problems as we can in this forum as we can. So with that, I'll introduce our panel. So to my left is Lieutenant Colonel Thompson. She is the Division Surgeon. We have Major General Winsky. He is the Commanding General for the 101st Airborne Air Assault, as well as the Senior Commander for Fort Campbell. To his left is CSM Barker, the Division CSM. And then to his left is Colonel Birchfield, the Commander of BOC. So with that, sir, I'll open or send it over to you.
All right, thanks, Jeremy. Well, hey, I'm Brian Winsky. I'm the Commanding General of the 101st, as Colonel Bell said, and Fort Campbell, Kentucky. And Command Sergeant Major Barker and I, the Division and Installation Command Sergeant Major, simply wanted to let you know and make sure you know what we know with regard to our response and the nation's response to COVID-19. It's imperative that we communicate effectively through venues like this and the chain of command, and again, meet the intent of ensuring that you know what we know. So based on the global impacts of COVID-19, we understand the entire Fort Campbell community has a lot of questions about things that we've implemented and things that are underway. And you also understand and appreciate the significance of the situation and the measures we've had to implement to protect our soldiers, civilians, and the families of Fort Campbell. Our absolute top priority is mission readiness for Fort Campbell units and protecting our Fort Campbell soldiers, families, and civilian workforce and the entire Fort Campbell community, including our retirees and their family members. It's a very dynamic situation, and conditions are going to continue to change. We'll continue to make risk-informed and risk-based decisions informed by our healthcare professionals, and we have our division surgeon and our hospital commander here with us on this panel, as well as our unit leadership, and then local through national government leaders, and most importantly, you, the Fort Campbell community. Up front, I'll tell you, we have 0 confirmed cases of COVID-19 cases here on Fort Campbell or the surrounding counties. But as you all know, there's been a little bit over 50 cases verified in Tennessee, generally in the Nashville and the area south of Nashville, and about 22 in Kentucky, generally in the Lexington and Louisville area. But again, none involving any Fort Campbell soldiers or family members, and none in the immediate area surrounding Fort Campbell. So let me get to right to some topics of concern. And again, we've gathered up a number of your questions already, and we'll address those, and then we'll take questions, and we'll stay as long as the question line is active. There's a lot of questions about schools, and that's something that we implemented starting today. So following Tennessee and Kentucky, which closed all public and private schools across the 2 states, the Fort Campbell's schools are closed, but today and tomorrow, the faculty will be there for students and parents to go to the schools, get course materials, clear out lockers, and then receive some preliminary instruction on how they'll conduct virtual classes, virtual education beyond next week, which was the planned spring break for both the county schools that surround us as well as the Fort Campbell schools. But the schools are going to remain closed. We'll have a decision point towards the end of March as to how long that will continue. But we'll implement procedures, and DODEA and the schools will as well, to continue virtual education beyond next week and the weeks that follow. There was a lot of questions about the child development centers, and we got some good news here. So we are going to keep the child development centers open. But one concern with a lot of families was having their kids there, and we know that a lot of people would like to take the kids out for the duration of this COVID-19 situation, but a challenge was with the fees. We found out this afternoon, and this is one of the feedback loops that we got from all of you, that we've got approval for people to pull their kids out of CDC for the duration of this COVID-19 situation without penalty. So you won't have to pay the fees while your child's out, and at the conclusion of all this, you'll be able to get your child back in. You won't have to go to the bottom of the waiting list, etc. And we're ready to entertain any more specific questions about that. But that's very good news, and that was one of the concerns. And I think it balances a lot of the families that were really reliant on the CDCs, through this period, and then families that had concerns and wanted to pull their children out, but were afraid to do so without having to continue to pay the fees or lose their place in the CDC where their child goes. Regarding the stop movement, everybody's probably heard quite a bit of this, and this began implementation effective today. The local area that soldiers will be allowed to take leave or pass is about the 80-mile radius. So that includes to the east, Nashville, Franklin area, to the west, Paducah area. That was a good discussion we had today with the unit leaders, and we determined that that's appropriate. Again, the overall intent of this stop move is to literally stop movement of soldiers and the Fort Campbell community to keep anything that may be in this area contained and to not bring the COVID-19 as much as possible into the Fort Campbell area. That's going to be a high level of approval to go outside of that leave or pass area currently with the Vice Chief of Staff of the Army. PCS and TDY. So any soldiers that were scheduled for temporary duty to a school, a non-commissioned officer education school, ranger school, sapper school, anything like that, that was scheduled beyond today, that we're going to postpone that. So we'll reschedule it when we can, but nobody is going to leave for TDY. Anybody that is currently on temporary duty at a school, they're going to finish that school and then come back at the conclusion. Again, those are all within continental United States, so they'll just simply come back and rejoin their families, rejoin their units. And for permanent change of station, we know a lot of people were in the middle of it. If somebody had already initiated movement for their permanent change of station, but have not yet reported into their new station, but they physically departed Fort Campbell, they'll continue with that permanent change of station and report into their new units. Anybody that was on PCS orders but has not yet departed Fort Campbell will stay here through the duration of the stop move, and we'll do what we can to help with temporary living arrangements for however long this period is that we're under the stop move provision. It's currently until the 11th of May. So that's temporary duty PCS. For those that were on leave prior to today, they're not to be recalled. They'll finish their leave, and if their leave was out of the continental United States, when they return, they're subject to 14-day quarantine. I'll talk about that in a second. If their leave was anywhere in a non-high-risk area within the states, they'll just simply return to their families and their units when the scheduled time or conclusion of their leave was. We're implementing some other things on Fort Campbell that we can talk about in as much detail as you'd like, where we have food services, Burger King, the food court, the smokehouse. We're going to set them up to essentially mirror the Nashville restaurants as an example for to-go only, so we don't have high concentrations of people in the dining areas there. The PX will remain open, the commissary will remain open based on your feedback. We've implemented some controls for some of the high demand items. I know the commissary got a pretty significant resupply today, so what you saw over the last few days should subside in the days and weeks ahead. We changed some procedures to post access where the guards aren't physically grabbing everyone's ID card. That may result in a little bit of a delay until we get the new techniques of scanning in people coming onto the base ironed out. But everything I've heard is that's going pretty well, and having gone through the gates a few times myself, it seems like it's going fairly well. A lot of questions about training. We have a lot of training underway, primarily for 1st, 2nd Brigade, the Vardy, the Aviation Brigade. Largely that will continue. The soldiers out in the field conducting collective training, it's one, critically important for the readiness, and two, the way they're arrayed and dispersed, they're fundamentally at less risk than soldiers in garrison that are transiting and having contact with a lot more people. We're glad to answer any more questions on that you may have as well. We're going to keep the gyms open for the same reasons. It's important for physical readiness of soldiers, but we're implementing some deep cleaning procedures that we're going to do there, some limitations in numbers, and we're going to keep it limited to just active duty service members, the lower risk population, and again, to help keep the crowds down inside the gyms. Quarantine and isolation. That's generated a lot of questions as well. We do have a number of soldiers and even some family members in quarantine that recently returned from overseas. That is a requirement, the 14-day quarantine. For the active duty service members that live in the barracks, we have a quarantine facility that's for their use or anybody else who elects to use it. It's a very suitable barracks building down by the airfield. We have it set up well for them. They have Wi-Fi. We bring them meals from the mess hall every day, and it's a good solid location for that 14-day quarantine. Some service members who are married elected to execute their quarantine in there out of concern of potentially elevated risk family members, young children, or perhaps their parents live with them or something like that. Another option, though, is in-home quarantine, where the soldier, and we give exact parameters as to what they can do, can quarantine at home, but they have to be asymptomatic, showing no signs of flu-like symptoms, fever, etc., and then they cannot have high-risk family members at home, and we can talk more about that. For family members, we have family members, and they're all in the in-home quarantine. It's a requirement for those living on post, and even for those off post. If they elect not to do that, they're going to be barred from post for that 14-day period of time. Isolation, we have none in isolation now. That would be the next level if we had somebody that's displaying symptoms of COVID-19, and we would further, within the quarantine population, put them in their own room with their own latrine where we can monitor them much closely, execute the formal test, and while we're awaiting the feedback, have them physically isolated from the other individuals down in that area. Again, we got the Blanchfield commander here and the division surgeon that'll talk through some of their screening and testing capabilities, some of the initiatives that we're doing with the pharmacy to reduce crowds there, and then just some fundamental instructions on when to call and when you might, if you think you might need a test, what the procedures are that we'll do to screen you and make sure we get you to the right folks. So again, the most important part of this is going to be taking your questions, and we stand by to do that. But Sergeant Major, do you have any opening comments?
Sir, I think you covered everything very, very thoroughly, but it's important for everybody to understand that a lot of these limitations that we're putting in place is to prevent the spread of the disease. I think is really the key thing that everybody takes away from this, and it's to protect the force and our family and community members of the Fort Campbell area.
Absolutely.
Great. So, well, I guess let's start there. So I thought it would take a little bit of time for the audience to warm up and ask questions, but we've got probably 20, 30 questions already. The first batch is really about BOC. So let's start there with you, Patrick. What have you instated over the last week or so to deal with COVID-19? What are the processes when somebody feels that they might be infected? And then there's a couple follow-ons on some of the ancillary services you provide.
So to start with, BOC is definitely training really hard to make sure that we're capable and we're able to take care of anything that happens in the future. What patients will notice when they first show up is that we ask them a couple of questions. We ask them if they've had any exposure to a known case or if they've had any travel to a known area of danger. If that's the case, then we're probably going to set them aside, we're going to give them a mask, and we're going to ask them some follow-on questions. Now, obviously, most people don't fit those parameters, and so we give them some hand sanitizer. We ask them to make sure that they do some social distancing, and we let them go about their business in the hospital.
Okay. So how many folks have you tested so far?
We have tested so far 14 at my latest count.
And how many came back negative, and how many are still pending?
So far, all but 3 have come back negative. 3 were still pending results. And as General Winsky said, there are no positive cases.
Excellent. So another question was about the pharmacy. So that's a common congestion point inside the hospital, but it's also a place where a lot of people congregate. So folks are a little concerned about what we have in place around the pharmacy.
Absolutely. So what we encourage people to do is drop off their prescriptions and go about their business. They'll be given a time when they can come back, and what that will do is it will minimize their time inside the waiting room. There are some people who choose to wait, and at this time we have not mandated that they cannot wait in the waiting room. That may change in the future, but right now what we want people to do is maximize dropping off, and we'll give them a time when they can come back, and we want them to maximize the mail order pharmacy option, which is a way to get your pharmaceuticals delivered right to your door.
Excellent. So Abigail has a specific question. Why is there a COVID parking section at the hospital?
It's a good question, Abigail. Thanks for doing that. Actually, we don't have a COVID parking section at the hospital. What we've done is we've set up the ability to, if someone thinks that they have the symptoms that are similar to COVID, we ask them to call the nurse advice line, and that's the 1-800-TRICARE line with the option 1. What they'll do is they'll get a chance to talk to a nurse, and that nurse is going to provide them some guidance. That nurse can provide them educational materials. And if that nurse thinks that they need to talk to a provider, that nurse will forward them to a provider right here on Fort Campbell. The provider will ask them some further questions that has to do with their exposure history and their symptomatology. If we think that that person meets the criteria to be swabbed or tested, so not screened, but tested for COVID at that point, we will give them instructions on how to drive up, get that testing done without ever leaving their car, and then continue to move out. If we're suspicious of them enough to get a testing, we're going to ask that they go into quarantine at that point. Quarantine is someone that we're ruling out for disease, not someone that has the disease.
Excellent. So the next batch of questions are really about CDCs, and I'll throw it over to you first, sir. A couple streams here. First, what are we doing with CDCs? Why are we open when the schools are closed? Was a common question. And then how are we protecting our workers and our children?
So about half of the Fort Campbell community feedback on CDCs was you got to keep them open. Dual military or working families are heavily reliant on it. And then about the other half is the best course of action to close them in conjunction with the schools and kind of just totally mitigate a lot of the risk. And I think what we have is a good balance. I think we're naturally going to see a reduction in terms of the number of kids using the facilities. That'll be helpful. We've instructed the CDC staff to really screen the kids coming in. If the kids are exhibiting any signs of illness, temperature, significant runny nose, etc., they're just not going to be allowed in during this period. We're going to do some enhanced cleaning measures, and again, if parents have concerns, they're going to be able to pull their kids out, or if they have a kid with an underlying factor that maybe puts the child at elevated risk of if exposed to COVID-19, actually getting it. Or having the effects of it, they can take them out, and when this is all behind us, be able to put them right back in. And during that time that they're out, they would not have to pay the fees. And that was a recent development and a big time concern from a lot of our families.
Absolutely. And we had talked a lot about this, sir, and for us, it really came down to, it was a readiness issue. Mm-hmm. So one, we had to make sure that our soldiers' heads were in the game. But two, also, we haven't had any cases locally, and that weighed heavily on our decision. We do believe that CDCs are kind of held to a higher standard than a school, both in terms of cleanliness and how much latitude we have in regulating who comes, who doesn't come.
Yep.
So.
And we have an exceptional workforce in our child development centers. Every one that I visited, I'm just always impressed with the neatness, the cleanliness, the orderliness of the facility, and the quality of the folks working there. So I think we have a good balance with what we have right now. And you kind of hinted towards something. As this evolves, we may be at a situation where if we start having positive cases in the immediate area, if we start having positive cases on post, we may implement some more measures that become more restrictive. But we think the approach we're taking now to the CDCs is appropriate for the current situation.
Absolutely. The next group of questions are really about training. And why do we have soldiers out in the field? Does that put them at more risk or less risk? Do we have the proper sanitation in the fields that we should?
Yep.
I'll throw it over to you, sir, and then CSM as well.
Sergeant Major, you want to kick that one off?
Yes, sir. Well, it's absolutely important that we continue to maintain our readiness is a key part of this, and also it's the risk mitigation. There's right now with no cases in the local area. Really, our soldiers have less risk of exposure if they're out in the field with their platoon, with their company, battery, or troop. And so that measure in itself is reducing their exposure to the greater community, with them potentially transiting off post, back on post, and going back home. and those typical interactions that happen in a garrison environment. So they're actually more secure and isolated being in that field environment.
And our overarching responsibility is, part of caring for our soldiers is ensuring that they are absolutely trained, prepared, and ready for the rigors of combat and all that waits them in combat. And if we find ourselves in this process here over the several weeks, months, etc., we cannot let that time slip by and not keep the edge relatively sharp in terms of training proficiencies, etc.
Okay. So to Lieutenant Colonel Thompson, a couple questions on what is our current threshold for folks meeting. Is it 100? Is it 50? President just put out 10. So folks are kind of wondering what the current policy is, and then why are we doing this? So if you can talk a little bit about the social distancing part of this.
Right. So one of the biggest ways to mitigate this prevention of this disease spread and to keep our population safe and healthy is really the social distancing. So that's preventing close contact, kind of that six feet apart rule. There's a kind of rule of thumb called 6 feet apart within 10 minutes. So not spending more than 10 minutes kind of in a close quarters with other folks. But social distancing is just whether you're kind of at home, whether you're at work, whether you're at the gym. It's just a common rule of thumb where we're trying to get our population to practice that to prevent the spread of disease. And we know that coronavirus spreads through respiratory droplets primarily. So again, when you cough or when you sneeze, that's the number way to transmit this virus. So kind of having that 6 foot spread between people is the best way to prevent transmission.
And so how long does the virus tend to last on just a surface, a hard surface like this per se?
Probably like a couple hours is what we kind of think. So another preventative medicine type technique is just continuous cleaning of high touch surface areas. So doorknobs, tables, countertops, those types of things in our bathrooms, our kitchens, our high traffic areas is kind of just keeping those cleaning solutions out and at least daily, if not twice daily, just good household practices. So.
And you mentioned a few hours, but this one has the potential in some circumstances to go a matter of a couple days, right?
Yeah.
Or stay on a surface a couple days.
Yes, sir. Yeah, I think that's why it gets back to just that continuous kind of being aware, cleaning surfaces. Yes, sir. Yeah.
So, sir, if you could just talk to our current policy on how many folks, what's our threshold for gatherings of people?
Yeah, as of today, it's generally 50. So, we're still going to conduct fundamental accountability type activities every morning, but the units know to do that in a distributed manner. PT will generally be platoon or smaller sized formations. I saw that this morning, a lot of dispersed small unit PT. There's some fundamental constraints on all of that in terms of, when the soldiers eat in the mess hall, they are just inherently going to be in closer proximity, and we're working through every possible way that we can do to distribute that by maximizing grab and go and those sorts of things. But again, the units understand the necessity of this and are implementing where it's appropriate for their units, the type of dispersion and how they're conducting day-to-day operations.
And we've already looked at, as an installation, as a command, as individual units, everybody's looked at the events that they have going on over the next 2 weeks and have made an assessment whether these are mission critical and must happen, and then if they are those higher population meetings, either bringing the population down to an acceptable level or canceling or modifying the event. So we do that on a case-by-case basis, and it seems to have worked so far.
Again, we'll adjust all of those measures, based on, again, as it stands right now, the surrounding 4 counties, no positive cases, on post, no positive cases. If that starts to increase, we'll adjust accordingly. And again, most when we talk about units, generally that population is pretty low risk. They're generally young, generally healthy, healthy soldiers. So again, we'll factor all of that in and get the unit leadership feedback and guidance from our higher, from Corps through ForceCom and on up.
Excellent. So there's a question very specifically about PT. I'll throw this over to you, CSM. They want to know, is PT going to be impacted by the coronavirus? Are we doing anything that limits PT in any way?
Well, I think as General Winsky laid out, we're doing it more in a distributed manner, more distance between folks. We're not going to see these mass formation runs during this time while this is going on. Where you got people breathing heavily on each other. So no combatives. Some of those measures where people are in close proximity, particularly indoors where the virus is spread more easily, we're avoiding those things. And then more frequent cleaning of our gyms and fitness facilities. But this is, as we've all said, this is evolving. So this is today's conditions, and this may change in the future. So everybody needs to be flexible and prepared for those things to happen.
So no specific person here. So this speaks to our 80-mile radius. Who does that apply to? And then folks who are also getting visitors. How is the post going to handle that?
Yeah, so we deliberated this quite a bit with all the leadership today, and kind of came up with the 80 miles as the best all-around kind of radius. It allows people with a medical referral to Vanderbilt, as an example, to be able to do that without some sort of exception to policy. There is no prohibition on people coming to visit, minus if they're coming from anywhere outside the continental United States. Then, just as they go through the screening center at JFK Airport or Seattle-Tacoma Airport, they're required by the CDC to execute a 14-day quarantine. So that is a requirement if somebody's visiting from Europe, Korea, etc. But other than that, family members visiting from anywhere in the continental United States is not prohibited. But the overall intent across the nation, and what is really key in terms of fighting this COVID-19 is to minimize movement across the board, so we don't spread and exponentially grow the COVID-19 in areas where it didn't exist prior, and then ultimately create such a load on the healthcare system that it can't keep up. So the intent behind everything that we're talking about is to minimize movement, and that's why there's some of these pretty significant measures in place. But again, the leave and pass is within that 80-mile radius, and then anything beyond that we have to bring to Headquarters Department of the Army, and it's got to be very significant humanitarian or significant hardship reasons beyond the normal parameters for emergency leave, etc. Overseas travel is likewise going to be very, very restricted, and if anybody were to be granted an exception to travel overseas, on return, they and their family would be subjected to the 14-day quarantine as well.
So Mark Barnhill has asked about the Air Assault School. What's the current status? Is it open? Are we doing training? Or is there any plans to curtail that in any way?
At this time, the Air Assault School and the Warrior Leader course are still open, only to the local population here on post. We're not bringing anybody from outside the installation. Again, keeping it within our community that we don't have any known exposure at this point. As things change, though, that dynamic may change down the road in the future. But for the time being, that we're keeping both the Warrior Leaders course open and our Assault School. Although Warrior Leaders course will be graduating early. And looking at going to a distributed method in the future.
For Air Assault School now, part of the zero-day activities, there's medics down there, and they're going to I shouldn't say that. During the course of 0 day, if any soldiers are exhibiting any kind of illness, etc., from runny nose to coughing, etc., any sort of symptoms for anything, common cold, flu, etc., they're going to be, depending on where they're at in the course, kind of drop-slipped right there to re-enter at that point once they're 100% not sick or ill in any way. So the classes will generally be smaller, but we are driving on with it. Again, with a long-term look toward the readiness of the force, it's important that we keep that going at this stage.
Yes, sir. So back to Bach. Testing seems to be on everyone's mind. So can you run through what your protocols are? So when somebody comes to you and asks questions about COVID-19, what tests do you do to rule out certain things, and then the process for testing itself, so from swabbing to who you send it to, how long it takes, those types of
Great question. So first of all, anyone that's ill should not automatically assume that they're a victim of the COVID-19 disease. It is flu season, and it is the coronavirus that causes COVID is also the same virus that causes the common cold. So we can't always look for zebras when we hear hoofbeats, right? So, but if someone has some symptoms that are similar to those with folks with COVID, we're looking specifically at a cough, a shortness of breath, a fever, and a contact with someone who's known to have had the disease or who has come from overseas, then that's going to trigger some further screening. So we ask those folks in that situation to call that nurse advice line that we talked about. The nurse advice line, if they think after talking to a patient or potential patient that they need some further attention, they're going to forward it to our own Bach internal COVID clinic. So we have nurses and providers right there ready to answer the phone, and they will talk to the individual patient. If that, in fact, if they decide that someone has the appropriate case history that we want to test them, then we will direct them to come up as I described before, and then we will take a viral swab. Now that's going to be a swab, an uncomfortable swab in the nose, and it's going to feel a whole lot like the same thing that you get for a flu test. I was tested for flu several weeks ago myself. It's not something I would like to do for recreation. So once we've got that sample, we're going to send those folks because now they're a person of interest, right? Once we've determined that their history is similar to someone with the disease, they're going to become a person of interest, and we've taken this test, and we're going to send that to the Tennessee State Department of Health. The Tennessee State Department of Health right now, today, is the one that controls all of the testing that we get to do here at Fort Campbell. That may change in the future, as people can see on the open source media that different private companies are trying to create testing, but right now today, the Tennessee Department of Health is who we go through.
So Bach does not have the ability to run tests?
Bach does not have the ability to run tests locally, nor will we. Even if we are able to use commercialized testing, it will be a send-out test. If we do, so currently we're looking at about a 3-day turnaround. If we get commercialized testing, it's not going to increase the test time yet, or decrease the time yet before we get the results.
Okay, great. Josh writes, what's being done at the commissary to limit those that were buying high demand items?
Yeah.
So that was a significant event over the weekend, sir.
It was. I had to do a grocery run this weekend myself, and I was astonished. Now the commissary got a resupply. That's going to flow through the week. No issues with that. And the commissary has implemented some basic, no more than 2 per customer kind of controls on the high demand items, and they're controlling a lot better. My wife, I just talked to her, went to the commissary this afternoon. She said, noticeable improvement from this weekend, and we hope to get that all on a steady plane here by midweek or so.
Absolutely. So one thing I would ask for those that are kind of in those queuing places is try to keep that social distance that we talked about, that 6-foot separation between you and another person. It's pretty easy to do in a commissary when you have a cart in front of you. That's a pretty good distance to do that with. But it's just in every line you're in, just keep a little bit more separation than you normally would. So we had a couple questions about PCS season. So that might be affected by current policies. Folks are asking about, this is Carla, Aaron, Clayton, and several others are asking about shipment of household goods and specifically those folks that are caught en route to Fort Campbell or elsewhere.
Yeah, so, well, the policy right now is any PCS that was underway, if they're already in motion, they departed Fort Campbell, they'll just proceed with their PCS leave plans and report into their unit when they originally planned. I know there are some folks that have their household goods shipped and then they were finishing clearing and they've not yet departed. They are to stay here until at least 11 May. And again, we're going to research ways that we can help with IHG for extended temporary lodging, the temporary lodging requirement associated with that. It may go beyond 11 May. That's the time now, that 60-day mark when it was first implemented, 6 March. And again, they're not to depart. For those that are on their way here, Likewise, if they've already departed their last duty station, so we have a projected gain that's currently on, PCS leave somewhere, they're going to arrive, and if they came from overseas, if they were in CONUS for more than 14 days at their leave location, they'll be fine. We'll integrate them through the replacement company to their unit. If they come directly from overseas, and we know about 90 soldiers left Korea just in the last couple days. I'd imagine a few of those are coming to Fort Campbell. On arrival, they'll go through the 14-day quarantine, the CalSU replacement company actions, and then get them integrated with their unit as well. So more to follow on what we're going to be able to do for those in the most difficult situation, which is already shipped the household goods, but they're stuck here at Fort Campbell now in terms of how we can accommodate them through temporary lodging expense and things like that.
Absolutely. I think what's important there is make sure your chain of command is aware.
Right.
You don't suffer in silence. Make sure that you clearly articulate what your issues are, because that's when we can really energize the whole breadth of the Army to fix it.
I know this has triggered a lot of, especially with next week being spring break, a lot of travel plans were significantly altered. Everybody at this table included, we all see it through a very empathetic eye, and I know a lot of families had significant vacations planned. A lot of folks had, a lot of PCS leave, things to do as a family en route to their next duty station. The good news is largely the airlines are being very good in terms of refunding or giving credit. The major hotels, everything I've heard of, are being pretty good with giving credit or refund, as is things like Airbnb, etc. I know there's some eaches with all of that, but again, largely a lot of the expense associated with what folks had planned and won't be able to do. Those companies, those airlines, those hotels are generally being pretty good about at least giving a credit, if not a refund, for that.
Yes, sir. Quick question for Lieutenant Colonel Thompson. When does that 14-day period start, the quarantine period?
So that 14-day period starts when the soldier or the individual comes back to Fort Campbell. So if they're coming from Korea, if they're coming from overseas, as soon as they get back, they check in with their chain of command, then that 14-day period starts.
Excellent. So soldiers on the border. So that's a question from Jesse. Either you or the CSM, can you talk a little bit about that?
Yeah, so that mission continues. That's about 1,500 soldiers out of 3rd Brigade. Sergeant Major Barker and I just visited them 2 weeks ago. They're doing an exceptional job with a critically important mission. The Department of Defense's #1 priority is to protect the homeland, and they are physically protecting the southern border of the homeland, the United States. So that mission's going to continue, but there are restrictions in terms of their ability to put soldiers on leave from their deployed location in an emergency situation, etc. So much like our soldiers here are contained to that local area, they are contained to the local area where they're serving now. Also in 3rd Brigade, they have basically a battalion in Africa in a few locations executing a critical security mission there, and as planned, we intend to internally rotate that force with another unit from 3rd Brigade in the months ahead. Looking a little further out, we have some other operational requirements that we're going to continue to prepare for and execute. There's no change to it. The Combat Aviation Brigade, as an example, deploys this June to Korea, to Europe, to Afghanistan, and some other locations. And they have preparations and things that they have to do between now and then to ensure that they're ready for that mission, which they absolutely will be. Elements of the Sustainment Brigade are deployed across multiple AORs right now, and they'll likewise continue their rotations as planned, supporting that. 1st and 2nd Brigade, as I said, they're on a training path for JRTC rotations in August, September, and then they will be part of the Contingency Response Force following that. So when they become part of the Contingency Response Force this fall, they need to be absolutely trained and ready, and that's why they're still on a path and training now in preparation for their Joint Readiness Training exercise in August in the case of 1st Brigade and September in the case of 2nd Brigade. There's other activity going on across the division, which will continue to prepare smaller units for their operational requirements. And our commitment and obligation is to ensure that whatever mission it is that we're sending Screaming Eagle soldiers on, that they're absolutely trained and ready. And all of our tenant units take that same approach. Sergeant Major, anything you wanted to add there?
No, sir.
This was a follow-on question from Malik. He said he's a soldier on the border now. Will he be able to come home for the birth of a child in April?
Yeah, April is just a few short weeks away, and I doubt that the leave restrictions will be lessened at that point. So everything will be looked at case by case. But as it stands right now, again, Department of the Army, the Vice Chief is the approver for that, and that's a pretty elevated level of approval, and they're really going to be significant humanitarian or significant hardship circumstances. But again, we'll look at it case by case, and if the situation drastically changes in the weeks ahead, and this is largely behind us in April, maybe, but if it's like it is now or worse, likely not.
Okay. Ceremonies seem to be an item of discussion. So more immediate is the retirement ceremony this week. But what are we doing writ large with ceremonies? Another question that was asked was Week of the Eagles. Is that going to be impacted? Mm-hmm. So kind of a breadth of topics there.
Yeah, so what we've done is we've really cut back on the participation in the ceremonies. The ceremonies will still take place, but at a much smaller scale. For example, with the retirement ceremony at the end of this week, we got about 34 retirees that we're looking at having. We're still gonna honor them in their service, but we're going to limit to them and their immediate family, and we're going to break it up into groups. But what we are going to do is take advantage of technology, just like we are tonight, and live stream these events, so that the greater community can share it and take part of them as well.
Excellent. Any initial thoughts, sir, on Week of the Eagles, and if probably too early to tell?
We'll cross, the decision point for that's still a few weeks down the road. If, again, this is largely behind us and the conditions warrant it, we'd proceed. But if it is the current conditions or worse, obviously that inherently involves large concentrations of troops, the division run, the division review, combatives tournament, all those sorts of things, not likely feasible if the conditions remain like they are now or worse.
Yes, sir. Let's see. So there's a couple questions. Michael has a question about restricting the civilian workforce. So right now we do not have any restrictions on the civilian workforce. We also don't have any restrictions on folks coming onto the installation. There was a question out there about, can retirees come on the installation? Are there any restrictions there? Can they come pick up medication at Bach? And all those things are still on the table. We still do that. We have not closed the post, but maybe a more broader perspective is, what are those escalating things that we could do over the next weeks or months if this does get worse?
So, back to right now, if we have civilian family members or part of the civilian workforce that were to non-comply with the 14-day quarantine coming back from overseas, we'd bar them from the installation. Even if they live on the installation, if they're not going to do the quarantine, we'd bar them from the installation, and that's part of what we do when we scan our ID cards. So they would be in a database, and when they get scanned, they'd get turned around by the gate guard for at least that quarantine period. If we get to the point where more significant measures are in place, in terms of restriction of movement, etc. Again, we'll do a good, careful analysis, get some feedback from all of the units, and make a kind of fact-informed decision. Again, knowing that a lot of the folks you're talking about are part of the fabric of Fort Campbell. They're part of the community of Fort Campbell, and they're soldiers for life with our retirees and their families, and our civilian workforce and our civilian family members. So we want to minimize the restrictions we put on them, but we have to focus on the paramount requirement of protecting the entirety of Fort Campbell, all our soldiers, our family members, our civilian workforce, etc.
Yes, sir. There is a medical question, so this will go over to you, Patrick, on expecting mothers. So are there any extra precautions that they need to take? And then Kristen has a follow-on question. So answer that one first, and then I'll come back to Kristen's question.
So my recommendation for mothers that are expecting would be the same recommendation for everyone else. Again, if you're an expectant mother, you don't want to get around someone who has the flu. You want to really avoid people who have the common cold. So there's no difference there. You really want to kind of protect yourself, as we all do, from someone who has an active illness. We currently don't have any reason to suspect that an expectant mother would take any other actions from anyone else.
And we consider an expectant mother, a pregnant mother, to be in that category of immune compromised, right? So the next question is from Christine. She's asking, what about family members with autoimmune disorders? When the service member goes to work and then comes back home, is that putting the family at additional risk? And then is there anything that is there anything that can be put in place to excuse a soldier from going to work?
Well, I think what we can do is to prevent that is we can offer space in the barracks and the facilities we have on the installation for that soldier to stay at, similar to what we've done with the family members that elect not to quarantine at home but to quarantine on post. Again, it's paramount that we maintain our readiness, and if we just leave the soldiers at home, they're not able to take part in the readiness training that's required with their formations.
Great. Any other suggestions on your end, Patrick?
So with regard to what the CDC recommends, it's distancing, right? It's kind of in-home social distancing. So if you have someone who's immunocompromised and no one is symptomatic in the home, then you can kind of go about your business. If you're worried, then do that social distancing piece. If someone becomes symptomatic, then you want to be really a lot more conscious about making sure that people are separated. They don't spend that more than roughly 10 minutes together in a small confined space, and maybe they don't share a bathroom, or maybe you do some extra surface cleaning around the home. Just take some extra precautions with regard to what we call droplet precautions, right? So again, the disease is spread through droplets. It's not floating through the air, it's droplets that fall, and that's why we have that 6-foot kind of area that we are concerned with. And then surfaces, right? So clean the surfaces extra, and take a little extra precaution if you have someone who in your home who may be a little bit more vulnerable.
Excellent. So another question is kind of related to calling. So you've already emphasized, don't come into the hospital. If you think you have an illness, call first. So folks are having a hard time because of the demand getting through to the hotline. So are there any other methods out there to address that?
So there are a couple of methods, but we really want to make sure that we funnel people through that nurse advice line. That's where you're going to get the most up-to-date. That's where you're going to get eventually to BOC. And then if for some reason, because the situation is dynamic, if we have to change the way we do things or where we send people, you'll have the most up-to-date information if you go to that line. Recognizing that sometimes people have a hard time getting through, there's a high demand, as you might imagine, and we're still kind of working through creating those lines. So it's a new process for us, as you know, funneling into that one new clinic that we've created. So it will get better.
Okay, great. That one was from, let's see, that was from Chelsea. So Chelsea, thanks for sending us that question. So maybe this is for Lieutenant Colonel Thompson. So for those that are being tested, are they quarantined right away while they're waiting results? What's that process look like?
Yeah, so the majority of the soldiers right now that are quarantined are asymptomatic, so there's no symptoms happening, but the precaution is being taken where they're in place with restriction of movement for 14 days. Now, if one of those soldiers was to develop a fever or a cough or shortness of breath, then they would move into, we would want to make sure that they were getting tested. So yes, so they would continue to remain in place with those restriction of movement parameters until that test came back either negative or positive within 3 days or so. So,
excellent.
Yes.
So a couple questions or issues centering around the 80 miles. So the 80 miles only applies to the military. It doesn't apply to retirees coming onto Fort Campbell. But some folks are saying, what if we've already had a pass or a leave already approved? Does that trump the?
It does.
Yeah.
Yeah. If they were on leave now before yesterday, they stay on leave for the planned duration of that leave and come back. But if you know, again, all of us had leaves planned in the next week or two, and they're postponed, and that's, you know, consistent across the division, all the tenant units, etc.
Excellent. Linda and Caitlin had a question about canceling vaccinations appointments for children. Any thoughts or insights into that, Patrick?
So similar to any vaccination, if your child is symptomatic, you may want to postpone that vaccination until a later date. Same thing, if your child is symptomatic, then you probably do want to postpone. If you're coming in for a well visit and you're just generally concerned, it's okay. We can postpone some of those things, and that makes sense. So what I'd like to inject is a healthy dose of common sense into all of our actions. Like the general said, it's about minimizing the spread, and so if you really don't need to get anything, but an immunization is a good example. If you can postpone that, then that might be a good idea. So I'd like to thank Linda and Caitlin for that.
So maybe for you, CSM, these are Shays Juliana. So for those courses that have been canceled, what are those actions that we're going to take as an installation to get folks back on that training pipeline?
So right now, TRADOC is working through this problem set right now, and what they're exploring is distance learning. A lot of these courses are tied to promotions. Promotions are tied to pay for our soldiers. So it's important that we keep these things on track and don't develop a backlog during the course of this epidemic. So they're working through the measures to be able to keep things on track and keep things moving forward. It won't be the business as usual as we get through this, but we will adapt.
So this one will be unpopular. I'm sorry, Lindsay. If gyms are only for active duty, are spouses able to attend gyms? And right now that answer is no. The next one, now we're starting to get into services provided. So Amanda asks about chapel service. We've looked at this. We decided to go with a full chapel service suite this weekend. And then on Wednesday, the CG will make a decision on what the future of chapel services will be. There's Chaplain Murphy has done a great job laying out what the requirements would be. He has a lot of options, both in terms of minimizing the congregation to an acceptable level, but also doing it via technology. So there's a lot of plans out there. The CG will ultimately make a decision on Wednesday. MWR is kind of the next servicer. So a lot of folks are wondering about the bowling center, but we also have other services. You have arts and crafts. You've got golf as another one. You have the auto repair shop. So if you could just take a moment to address those types of services.
Yeah, we're going to take a hard look at all of them. You know, for all the food, the MWR food places, again, you know, paralleling what's going to be going on off post here in Clarksville and Nashville, other metro areas, to-go service, but you know, minimize the crowds of folks inside there. Bowling has the obvious challenges with you know, potential for communicating, passing on things. So we've already made the decision on that, along with the gymnastics program and some of the other things. And we'll, as each you know, set of circumstances surfaces, we'll take a hard look at it and make informed decisions with feedback from the Garrison team and you know, the leadership at all echelons.
Excellent. So this is to kind of provide a bit of a perspective and maybe some understanding. When we look at these services, you have to look at it in two ways. The first is to protect the population. So if we have large gatherings of people, we don't necessarily want to provide that service. We may need to alter it, or we may need to cancel it outright. But the other piece of this is the workers that work these services are the same folks that are in our communities. So they're also affected by school closings and all that. So we also have to look at it in terms of what can we provide based on the workforce that we have. So like the CG said, we look at this routinely, and we look at every service that we provide, and we try to make sure that If we can provide it, we do, but if it offers too much of a risk or it's untenable in the long term, then we remove it. So this is from Alan. How do family members coming from high-risk areas get to their homes on post? So really the question is more about communication. When we have a high-risk individual and they have self-identified, what are the mechanisms that they probably need to do beforehand, before they get to an installation, to let us know?
Yeah, well, we maybe talk high. Are you saying high-risk medical conditions?
So high-risk areas.
Yeah.
So this could be anywhere overseas or high-risk areas within the United States, like your Washington.
Yeah, so anybody
States.
coming from overseas, again, the requirement right now is the 14-day quarantine. And then if they're coming from a higher risk area, like Washington State right now, like New Rochelle, New York right now, obviously inform the chain of command.
That's right.
And we can offer potential screening right away on arrival, and go from there in terms of if it's if they've been exposed to identified COVID-19 carriers or people that have the disease, that puts them in that elevated risk category, and somebody that we'd want to screen and determine if we want to formally test before fully integrating into the community.
And they can do their quarantine en route, so they can stay with family members for 14 days, and then just let the in-processing folks know that process has been done.
Yep.
Anything to add, CSM?
No, it's a tough situation. I know a lot of folks right now at this point are kind of stuck in that mode. I think as this progresses, a week ago none of us saw this coming, and we've had to take some pretty drastic measures up front. But as these measures go into effect, we're gonna find fewer and fewer of these hardship cases as we execute these processes.
That's right. I think the stop movement actually helps us kind of get in a good stance, a proactive stance, because those that were planning on leaving are staying, and those that were planning on leaving from here are staying. So we're not going to be in that constant, perpetual guessing game. So in a way, it gives us some additional.
The stop movement is the key, and everyone at all echelons, from Center of Disease Control to national level, entities that are focused on this. And when you look at what stemmed the tide in Daegu, Korea, and is starting to stem the tide in northern Italy, it's the stop people from moving and spreading it out, to again turn that mountain of medical emergencies into more of a gentle slope and sand dune type of thing.
That's right, and some of this is ownership on the individuals, the family members, the soldiers. If you think you've come into contact, then you need to come online and let the appropriate medical provider know. If you've traveled to a high-risk area, again, this is all about communication. It's let us know what you think your current situation is, and then we can help you address that. You don't have to do it on your own. Certainly minimizing how many crowds or what types of crowds that you congregate in. The social distancing is important. So you can do a lot just from your just by yourself. So Kylie, I'm sorry, Clyde, or wait, nope, this is from Mandy. Is Bach canceling surgeries right now, and what's the long-term impact?
Thanks, Mandy. So right now, Bach is under normal operating conditions. Again, very fluid situation, and like Sergeant Major said, if next week the situation looks different, next week the situation may be different. But right now, all surgeries that are scheduled to continue.
Okay. Let's see. Sabrina had asked about the month of the military child. This is very much similar to the Week of the Eagles. So as we get a little bit closer to the month of the military child, we'll assess each of these events as they become closer, and then assess whether it's prudent to continue or cancel. Month of the military child has a lot of different events, and a lot of them are high crowd events. So we'll take a look at that very carefully as it approaches. So this is from, let's see, if our chain of command is enforcing a smaller radius than the 80 miles, but our families have medical needs at Vanderbilt. How should we proceed?
I mean, we just came to the conclusion on the 80-mile radius, so that may not be just enforcing a tighter standard. It just may be their understanding of what it might, what the decision might have been. So we were going back and forth, and we determined 80 in large part because of medical referrals to Vanderbilt, and we would want people to be able to do that without needing an exception of policy to go there, et cetera.
Yeah.
Sermon, you were going to say?
Yeah, I think we were in flux this weekend as rapid as things were coming down this weekend. Very dynamic environment, and what was initially we were looking at 50, but realizing the facilities that were necessary outside that 50-mile radius, we made the adjustment this afternoon.
A big part of the concern with Nashville was, had Nashville been business as usual, there's high probability for passing on COVID-19 and Music Row, Broadway, all of that. Now that is all largely shut down by direction of the governor and the city leadership of Nashville. So again, the intent would still be to minimize movement way away from the Fort Campbell area, but if need be and you have to go to Vanderbilt, we're able to do that without big waivers required and that sort of thing.
Yes, sir. So I'll throw this out to the audience. If I didn't get to your question or I skipped over it, please ask it again. There's no harm in doing that. We're kind of slowing down on questions, so again, just re-energize your questions, bring it to the top, and I'll ask it. So this question is about training as well, and when we start sending soldiers to other locations to train, this individual, Rayleigh, her husband is supposed to go to Fort Knox. Is that affected by the travel restrictions?
Yeah, we're, Fort Knox is fundamentally our northern training area, and we have units going up there, particularly our cavalry squadrons, our recon squadrons, our weapons companies, to do the heavy weapons gunnery. It's a much better set of facilities and ranges than what we have, are better suited for that because it used to be the Armor Center. So right now, we discussed this very specifically with the units involved. We're going to drive on with that, barring the surfacing of known COVID-19 cases in those areas. We also have some elements training up at Camp Atterbury, Indiana, and there's a specialized training facility there that's really important that they execute before, again, they continue on this path towards JRTC and being in the contingency response force. So as it stands right now, we'll continue to watch it, monitor it very closely to see if there's any elevated risk in that particular area. There's no palpable difference in risk there than there is here, so we're going to drive on with it. And again, for all the reasons Command Sergeant Major Barker said, the way they'll be arrayed there will minimize the risk of transmitting this just as it would for an element out in the field here at Fort Campbell.
Excellent. So William, to answer your question, the 80-mile restriction was just implemented about an hour ago, so your chain of command may have been going off of a more strict 50-mile radius, but that decision was just made, so that is the standard. For Jody, they ask, how are we supposed to go about homeschooling if both parents work and the child goes to a school-age center? I can take a little bit of this, so I'll talk a little bit about what DODEA is doing. I talk to DODEA frequently, especially as we were starting to lead up to the decision to close. And what they have said to me is for middle school and high school, they will continue, the student will essentially continue their scheduled activities as if they were in school. They'll just do it online. So they very much follow the same schedule that they would have in a school. For those that are below middle school, the requirement is really just do assignments day to day, but then they have a requirement to do 3 touches in a week. For your specific question, Jody, really I can't address your specific circumstance, but again, if you truly communicate your issues and your concerns with your chain of command, they will be able to help you. So Sasha asks, do we have any idea when schools will be back in session?
Right now, we know they're closed till 30 March, and we're going to make an assessment before that. And the key thing for all the families I know is predictability. So as soon as we get a good feel for what the situation is going to be beyond that, and if the conditions will be met to reopen the schools, we'll communicate that. But we'll watch it with our DODEA partners, daily and review it daily, cyclically.
Excellent. What about U.S. civilian truck drivers who make daily deliveries to posts? How are they going to be impacted?
Yeah, why don't speak to some of the screening things that we'll do there.
So this is a gap for us, and really it's a risk because the truck drivers, especially if they're going interstate, travel through areas that are high risk. Do we necessarily think that every truck driver is a high risk individual? No. But we as an installation have to look at that particular piece of entry into Fort Campbell and look at it very seriously. So we looked at it over the weekend. We think we're going to in place a screening mechanism at gate 7, and really it's just a series of questions, 3 questions that are asked each driver, and if during that screening process they identify that they've been in a high risk area or may have been in contact with somebody who has the COVID-19 virus, then we will just implement more stringent measures for their entry onto the installation. So what this would look like is they would have to remain in their truck the whole time. They would get escorted from their point of entry onto Fort Campbell to their point of unloading, and then escorted back off the installation. Good question. So DFACS is another question. So what have we done so far? This is from Arturo. What have we done so far to make our DFACs a little bit more safe for our soldiers? And then are DFACs still open, getting deliveries?
Yep. DFACs are still open. We're maximizing the grab and goes. We're implementing some procedures where there's rigid adherence to hand washing station actions before they go through the head count. For things like the salad bar, we don't have the spoons, ladles, etc. in the food where everybody that comes by serves themselves and you end up having hundreds of hands touch the same spoon. It's all packaged and ready. We want to balance that with obviously still making healthy food choices readily available for our soldiers. And then there's been some dispersion. Some units have ergonomically adjusted their dining areas and thinned out the number of seats in there. Again, with grab and goes, encouraging soldiers to grab it and go eat back in either barracks unit area or a more dispersed locations. So those are the main things. Sergeant Major, was there anything else that we're doing with the mess halls?
Those are the key points, and really it's the keys are the distancing, keeping our distance, and minimizing the contact on those common surfaces.
Excellent. So Catherine had a question about training, and this is CTCs related. So are CTC rotations still being executed?
Yeah, ours are in August and September for 1st and 2nd Brigade. So what we're planning right now is that they will be, and it's makes it all that important to ensure that we stay on the training path to make sure they're ready for that. Right. So there's some very near-term ones that the Army is making some key decisions on based on the COVID-19 threat right now. As the dates approach, we'll obviously make decisions, well in advance, 30, 45, 60 days ahead of time, based on the conditions, both here at Fort Campbell, at Fort Polk, and the other conditions across the nation, frankly, at that point, before
Absolutely.
We decide on anything.
And then for you, Patrick, Tia wants to know how will COVID-19 affect the MEB process, if at all?
Yeah, interesting question. So one of the things that we're looking at is there's a lot of things that the IDES folks can do from their telephone, from Facebook Live, FaceTime, that kind of a thing. So anything that requires a hands-on physical exam, folks will have to come in. Otherwise, we're going to largely move towards doing things in a distributed manner.
Okay. And then Jerry had a very similar question, but related to SFL TAP, and I'll take that one on. So that is one of the areas, so I don't have an answer for you, Jerry, right now, but that is one of the areas that my folks have to come back and brief me on to see what the impact of a distance learning type environment would be versus thinning out crowds versus individual appointments. So we're looking at that carefully. We'll have an answer to you, and we'll post that when we make a decision. So EFMB is a item of concern for Lana. Is that going to still take place?
It is. Sermon,
Yeah, right now, EFMB, as of now, EFMB is still on schedule. We're working through an exception to do the validation for the lanes with the MedCom. And then we also turned off all the folks that were coming from other installations to do EFMB here. So it'll be just individuals that are organic to Fort Campbell that'll be participating in the event. But again, things can change, and we're working through some of the challenges right now with that. We may change the model that we use for it to be able to accommodate with the necessary precautions as well.
Excellent. So Regina had a question. This is probably for you, Patrick, more general, but dental clinics, are they still operating on their regular schedule? And is anything being done at the dental clinics since you're dealing with somebody's mouth, to protect the employees?
So similarly, dental clinics, when you go in, you may notice that they put on face masks, they put on gloves, they put on gowns. These are the same precautions that we want to use every time, right? Every time you go to the dental clinic. So right now there aren't any changes in the scheduling that I'm aware of, and so and their PPE, their personal protective equipment that they wear should be exactly what they do every time.
Excellent. All right, so Ashley had a question. Are Dodia schools offering meals for students like off-post schools are? So Ashley, I'm not really sure what you're trying to get at with that question. So what I'd ask is, we have folks in the back room, they'll type a response for you, and maybe you can go back and forth and get a little bit more detail on your question. For those, we're kind of running short of questions right now. So for folks in the audience, we have folks in the back room, and they've been typing back and forth to you, trying to answer questions that I may not have gotten through. But we also, for any ones that we did not answer during the show, what we'll do is we'll post the answers to those questions at sometime this week, so that you can refer back to them. We'll also post the show itself on Facebook, a link to YouTube, so that you can go back and reference anything that we've said here today. All right, well, I think we're kind of running out of questions, sir.
All right.
Can I?
Amy, anything?
No, sir.
No, sir.
Sorry?
Yes, sir. I think it's just important for everybody to acknowledge that this is uncharted territory for all of us, and what we did as business as usual we can't do in this environment. So it's going to be inconvenient. It's going to be challenging, but we all need to work together as a community to get through this crisis, and we'll make it out on the end.
Yeah. Well, thank you everyone for your time. I hope we answered a lot of your questions, and this is a rapidly evolving situation, and we'll do this as frequently as we need to. Every time there's a significant change or there's significant measures that we have to implement, we want you, as I said up front, Sergeant Major Barker and I want you to know what we know, and we absolutely welcome your feedback and your ideas. We're all in this together. We're all significantly affected by this, and it's going to get bigger, I think, before it gets smaller. And we'll continue, as we always have as a community here, to get through this with minimal disruption on our families, and all the while protecting our families, our service members, and the broader Fort Campbell community. So thank you so much for your time, and thanks to the Garrison team for putting this town hall together. Thanks.
Thanks, sir.